Dr. John Campbell, thank you very much indeed for joining us on the Mother of All talk shows. Now, I'd like to tax your expertise a bit on one or two aspects. But start off, please, by telling us how you'd vote in my poll and why.
That's a very good question, George. Now, the reaction of my government and indeed governments around the world and indeed the World Health Organization has been one of varying their tune as they've gone along. So a lot of people started off reasonably badly and then they've got gradually better as time goes on. So the whole problem is really that world governments and a lot of leaders have been reactive rather than proactive. They're reacting to the situation that they find themselves in rather than anticipating the situation and working ahead about it. Now, if you'd asked me that question about a month ago, I would say the answer was it's quite abysmal, that we're not taking anything like enough precautions, that we're not taking this seriously enough, that they don't really understand what the word pandemic means. They might be able to write it down on a blackboard, but pandemic, what it really means for the people, the death and the suffering and the disruption that causes. I just don't think they got it. And if we looked at people in Parliament, not just the UK Parliament, but anywhere in the world, people were still close together, they were still shaking hands. They just weren't getting it. But for the last week or two, since we've had the lockdown, I think now the government really understands. I think the penny has dropped. I think the message has got through. And the way we're handling it now is really getting quite a lot better with this lockdown. But there's still a lot of things we can improve. And the big thing that's missing in the UK response, although it's there now and it's starting today with the drive-through testing for NHS staff, is just that, testing. We need massively more testing. So we're suppressing this epidemic, this pandemic from on the top, but we need to pick away at it from the bottom by specific testing, by isolating every case, by quarantining all of the contacts of that case. Then we can have a much more surgical approach rather than this blanket top-down approach that we're using. But right now, I'd say they're trying really hard. Boris has ordered 3.5 million tests, which is a great start. We're going to need a lot more than that. But I think now the government has got its bit between its teeth. It realises this is a serious global problem, and it's actually doing quite well as of the last week.
Why do you think so many people, including watching and listening to this show now and writing in, simply don't believe it? They think that, let me talk at the more respectable end of that kind of attitude, would be the Daily Mail journalist Peter Hitchens, who doesn't deny that the virus exists, who regrets every death that it causes, but insists that a significant number, perhaps 2/3 or more than 2/3, of the people who died in the last 3 months in Britain would have died this year anyway.
I don't think that's accurate. I mean, the coronavirus and the COVID-19 disease, we know is exacerbating other conditions and is more dangerous in other conditions. And we know that the older people are, the more likely they are to die if they get this condition because they're going to get complications from it. But these are people that could have lasted for many years into the future. We simply don't know that. So it seems like there's a bit of denial going on here. This is a virus that makes people very sick and can cause acute conditions. So, for example, of all the people that get it, while we're grateful that most people, about 80%, get a fairly mild illness, we know there's about 12%, or some studies say 14% of people that get really quite ill with this, up to the point where they might need some medical intervention, such as additional oxygen, such as intravenous antibiotics, such as intravenous fluids. But we also know there's about 5% of people get critically ill with it. And this is what is causing the death of these people. And without a lot of intervention, then the case fatality rate will rise. And we know there's a case fatality rate in this. In Italy, we've seen a horrendous case fatality rate. It's been round about, well, some of the figures work out at 9 or 10%. Now, we don't believe it's anything like that high. The chief medical officer still believes that round about 1% is a nearer figure. But you can't argue with the science that of 100 people that get this infection, about one of them is going to die. That is just simple epidemiological science. That's simple maths. And to deny that it's a bit like being in the Flat Earth Society or something.
It is. A lot of them are Flat Earth types, and it's a fad. Extinction Rebellion, Flat Earth. and now deniers of the coronavirus. However, the percentage of people who die is only quantifiable if you know how many people have got it. And you can't know how many people have got it until you have either randomly tested the whole population or actually tested everybody in the population. In other words, if 10 out of every 100 that you have tested are dying, you've got a 10% death rate. But if there's another 1,000 times more people that have never been tested but may have it, then the proportion of people who die from it is very much smaller, isn't it?
Absolutely, George. The case fatality rate can only be accurately calculated at the end of an epidemic when you're looking back retrospectively. Only at the end then will you have an antibody test so you can see how many people have had it. So if we look at the horrendous death rate in Italy at the moment, which has been around about 10%, well, we know that's actually dropped quite a bit in the last few days because Italy have instigated much larger scale testing, and they're testing many, many more people. So as they test more and more people, there's a greater denominator at the bottom, and the death rate looks relatively smaller in terms of percentage, in terms of case fatality rate. But having said that, the Chinese Center for Disease Control did do a study of about 72,000 people who were diagnosed positive in China, and did come to figures round about this 1% mark. And also, as well as that, in South Korea, where there's very extensive testing, very advanced testing, again, the figures are working out at round about 1% because of the large amount of testing. And again, in Germany, because there's been a large amount of testing, the case fatality rate there does appear to be lower. But you're absolutely correct. I mean, how many people in the UK have got COVID-19 infection now? The answer to that question is we simply don't know. It's likely to be at least 10 times the official figure, and some people say it could be 1 million or well over 1 million. Now, if that's the case fatality rate is going to be greatly lower. But there's a big proviso here, in that people have got probably an incubation period of, say, a week on average. It can be 2 to 14 days. And then they're sick for a week or two. And only usually in the second week do people develop severe complications. So typically someone is not going to die until 2, 3, 4, or even 5 or 6 weeks after the onset of symptoms. So there's a big lag in the amount of deaths. So when the total amount of deaths are counted up in a few weeks' time, it is going to be higher. But there again, when we do more testing, we're going to know what the numbers are, and it's going to be higher. But we're never going to know the true fatality rate until we do this antibody test. You probably know there's two sorts of testing. There's the antigen test, which tests for the presence of the virus. Is someone infected now? And there's the antibody test, and I believe we're getting a lot of those quite soon, that shows where the virus has been. It's testing for the immune protein that the virus has made in people's blood, and that will tell us who has had it. And it's only, as you rightly say, when we test the antibodies of everyone in the country, know how many total cases there are, and then compare that to the total number of deaths, that we'll have the accurate case fatality rate. But the current estimate of 1%, I'm afraid, might not be too far out at the end of the day when we calculate these final figures in a few years' time.
Of course, if it's your mother or my mother that dies from it, they're 100% dead, and we've 100% lost them. So I'm not quite sure where some of these conspiracy theorists are coming from, because a lot of people's mothers have already died, and they might well, as you say, have lasted another year, 2, 5 more years. And there's a remarkable, I don't know, equanimity with which these things are viewed. It's funnily enough, people who think of themselves on the left but are positively Malthusian in their willingness to see the elderly, the weak, the infirm go to the knacker's yard. But what do you say to this point, Doctor? There's a difference between someone dying with coronavirus and someone dying from coronavirus. In other words, coronavirus may have been the tipping point, perhaps, but so many other conditions, weaknesses, underlying problems existed in that patient that the coronavirus is only one of the factors.
Yes. So if people die with coronavirus, that by definition means it is an acute illness, because someone will contract the virus will multiply inside their body, and then they'll get clinical features about a week later. And the virus is going to be detectable for a few days before they get clinical symptoms. Indeed, is going to be transmissible for a few days before they get symptoms. And then the virus is going to be present in appreciable numbers for about 8 days after that. So what that means, most people are only going to have an infectious dose of the virus for about 10 days. So if people die with coronavirus, there's only a 10-day window in that time. So it's very likely that that virus has been the actual facilitating cause or the actual precipitating cause of their death. It's not like, saying, prostate cancer, where you can have it for 10 or 20 years before it kills you and people die with it rather than from it. I believe these people are dying primarily from coronavirus and COVID-19 disease. And, to me, this is an absolutely central point, because what is it that makes a society civilized? To me, civilization is defined by the way it looks after the weaker members of that society. And while in epidemiology and this sort of study, we do have to talk about numbers, and that's necessary to have that objectivity and talk about numbers. But at the same time, we have to remember, as nurses and doctors, that these are human beings. As anyone, we have to remember that they're human beings. And as a society, I judge the advancement of a society and the civilization of a society by how it treats its weakest members. And we need to look after the weakest members of our society. But having said that, I think our government is doing that now with this lockdown. So this is very encouraging. They're no longer seen as expendable. The initial policy of the government, where we were going to go for herd immunity, would have involved horrendous losses. And just thank goodness that they actually changed that. And they changed that based on modelling from Imperial College London.
Although Imperial have a patchy record, according to Professor at Edinburgh University, I'm quoting him, I think, accurately, and the Oxford University study gives a different picture, and Imperial themselves now say that the 250,000 figure of likely deaths in Britain can now be expected to be around 20,000, in other words, 1/10 or less than of what they originally said. Is there a danger that we could be following a policy based on flawed analysis statistics?
There's always that danger, but Imperial College are actually using accepted epidemiological techniques, and they are a centre of the World Health Organization as well. And of course, that's a completely separate debate as to how the World Health Organization have done in this. But what they have is very sophisticated mathematical epidemiological models. And these have been developed quite extensively, actually, over the past 20 years. But they're based on the influenza virus. But having said that, the transmissibility of the influenza virus and the COVID-19 coronavirus is fairly similar. And in fact, the coronavirus is more transmissible than the influenza virus under usual conditions. So the modelling they're using, the models they use are fairly sophisticated. And that initial data that showed that there was going to be a horrendous amount of deaths is one reason why the government changed its strategy. And I believe this new 20,000 figure that Imperial are now talking about takes into account the lockdown and anticipates the increasing testing that's going to happen. But it's still sobering to note that 20,000 is probably the minimum amount of deaths that the government is anticipating. So I think we have to be based on science, George, because if we're not based on science, we're based on opinion and subjectivism. And we have to be as objective as we can, and we have to go with the evidence that we've got. And I do see that has happened to some extent. And I really believe the strategies that we're following now of the lockdown and the way we reduce the social interactions, we know that does greatly increase the transmissibility of the virus. Not that it changes the transmissibility of the virus itself, of course. It doesn't change the biology of the virus. But what we have to remember is this virus can only live inside the human respiratory tract. It can only multiply inside human cells. And if we physically separate those human beings, we deny the virus that opportunity to transmit. Therefore, we break up its lifestyle and stop it from transmitting. And this is what we've seen with the reduction in number in China, the stabilization of the numbers and reduction of numbers in South Korea, and again in Taiwan, and to some extent in Hong Kong, although Hong Kong have backslidden a bit lately as some of the restrictions have been reduced.
What about this last point, Doctor, and I'm grateful for your time.
Pleasure.
A few of the lads in the office this evening, by the grace of God, have not had any corona symptoms, but they're going nuts. They're going mad, cut off from life, stuck in their houses, some of them unmarried, some of them champing at the bit. There is a mental health cost as well as a societal cost, and of course not to mention a gigantic economic cost from this period of lockdown and isolation, isn't there?
You're absolutely right, George. I mean, technically at the moment you can't take your girlfriend for a walk if she doesn't live in the same household.
Quite.
It really is. These implementations are quite draconian, but they are based on this epidemiology. But we have to remember that people are body, soul, mind, spirit. We are eclectic, holistic beings, and we just have to be so aware of the anxiety, the stress, the mental stress. I mean, for example, I'm on record as saying that there'll be an increase in birth rate in December, which is 9 months from now, of course. And there'll also be an increase in things like, I regret to say, probably domestic violence, divorce, all sorts of problems with people being forced to stay in the household. And for young people, especially, as you say, who are chomping at the bit, they want to get out, they want to be doing things, they want to be living their lives. It's very difficult for them. And we really have to come together and support each other in this and realise that everyone is in the same position. And this cost is immense. But the alternative is a cost which is probably even higher, and that is many people will die. And this can include young people as well, because although the probability of death increases with comorbidities, although the probability of death increases with increasing age, we still get some tragic cases of young, fit people with no comorbidities that get this and die. This tragic case of the ENT surgeon, for example, who died today after working in an A&E department. I don't know. We don't know why young fit people sometimes die, but they sometimes do. So the balance is: are we going to put up with this confinement for what may turn out to be a good few months, to be quite honest, or are we going to risk the individual's death going out, and as they come into other contact with other people and come into contact with vulnerable people, the almost certain risk of quite a few of the vulnerable people they're going to come into contact with. So it's a really difficult equation. I don't pretend to have the answer, but what I do know is we need to support each other through it, understand our anxieties, understand our frustrations, and communicate. Human beings are communicators, and we have to come alongside people allegorically, even if we can't come alongside them physically, and really support people as much as we can through this. So make that call, make that internet connection, make that Facebook friend, and just make people feel included, that we're all going through this together, because we are.
Dr. John Campbell, thank you very